wonderful energy in the room, and I look forward to continuing the conversations. We're now going to continue talking about impact and insight, and Krishna Udayakumar of the International Partnership for Innovative Healthcare is going to moderate this session, and you will be introducing the session and your panelists. Krishna.
Okay, thank you very much, and looks like everybody made it back and even more energized with some more caffeine. So we're going to spend most of our time in discussion, but to frame that discussion, I wanted to give a quick perspective of some of the work, and this session is really going to focus on innovative partnerships and what we can learn from studying them. And to do that, I have Lila Cruikshank, who's working currently as the Director of Business Development for One Family Health. And we have virtually Gunter Faber, who is the founder and chair of One Family Health. So I provided a bit of a superficial framework and context for some of the work in the earlier session, and we thought it would be helpful really to focus on the depth to complement that. So rather than talk about 3 or 4 different models, we thought it would be really helpful to go deeper on one model that which is One Family Health. And it seems to fit very nicely at this intersection of women's empowerment, health system strengthening, and nurses and midwifery. And so we really want to get into the depth of what it is they do, how it works, and have more of a discussion around that. So to frame that piece of it, I wanted to step back a little bit and tell you a bit about our own approach through IPIHD to understanding partnerships, trying to support partnerships to scale health innovation. So IPIHD is a nonprofit that was co-founded 4 years ago by Duke University, McKinsey & Company, as well as the World Economic Forum, with the idea that if we could actually identify and curate the best health innovations from around the world, we could then build support systems and programs that help to scale and replicate those models everywhere. And we do that by focusing on 4 aspects of the work. The first is really to identify and curate and network of innovations, and over 4 years we've now built a network of 55 different organizations that work all around the world, the majority of them operating in low and middle income countries, where we're starting to see real outlets for creativity and transformative innovation. And by understanding these different types of health innovations, the second aspect of our work is then to try to strengthen both the organizations as well as the innovations themselves to try to scale their impact. The third is then to spread innovation across organizations and across boundaries, and I'll tell you a bit about some of that work. And then lastly, to do this, again, from the context of a learning organization so that we generate evidence and data over time and improve our own effectiveness and also help others to do this in more effective ways. And when I talk about health innovations, we've used this categorization. There are lots of different categorizations there, but we tend to look at a lens of mechanisms that directly impact health or healthcare services. And so one aspect of that is direct provision of services. The second aspect of that is financing mechanisms, and when here we don't mean country level macro financing, but much more about almost micro insurance and related schemes. So for example, Changamka is working in Kenya, and they leverage the existing M-Pesa mobile money platform to provide ways for people to save gradually over time to be able to afford health insurance. And so it's novel mechanisms to try to finance access to health services. The third piece of this is around health workforce training and development, which I don't need to explain the importance of to this group, but clearly there are mechanisms that I mentioned earlier. LifeNet International is one of the innovators that are working in that space. We also see products or technologies. Frankly, I bring a fairly skeptical approach to technology for the sake of technology, so we're very disciplined to say that unless there's a real value chain around it or a proven way that it improves health or healthcare, that we stay away from technologies, because that's the easy thing to look at, but very few technologies are proven in health settings, especially to be cost effective. And then largely, things that are forgotten around support systems. So an example there is Riders for Health, and what they do is actually manage a fleet of vehicles across sub-Saharan Africa, because we know that, especially in public sectors, the maintenance and upkeep of fleets of vehicles doesn't happen effectively, and so they provide a mechanism to cost effectively ensure that health supplies and health workforce get to where they need to be. So those are the types of innovations we work with. The ways that we think about strengthening include direct provision of support services to actually work with entrepreneurs and their enterprises to help strengthen their organizational capacities. A lot of what we do is trying to leverage a broad community to build networking and learning opportunities, both from peers as well as others working in the space. And then a part of what we do is try to facilitate access to financing by working with folks like Beth and the Calvert Foundation to actually landscape what's out there and where the gaps are, and then to try to fill those gaps over time. I do want to mention one of the ways that we're working, and I think this is a good example of a partnership where we can leverage the strength of academic institutions, is a program called the Social Entrepreneurship Accelerator at Duke. And it's a partnership with USAID through the Higher Education Solutions Network, where we are actually operating our own global health accelerator. So we bring in on an annual basis 6 to 8 enterprises, so like the ones we're talking about today, based in either East Africa or India, and we work with them over 3 years to build specific organizational capacity to help them to access funding, and we do that by leveraging a network of impact investors, by tapping into the expertise and passion of faculty and students across a major university, as well as reaching into the corporate sector through the networks of IPHD and others. And what we hope to produce out of this is, one, to actually increase the scale of impact of these organizations, and secondly, to generate evidence and insights and toolkits that help others to be more effective at scaling impact of social innovation. Susan earlier today mentioned this idea of bringing some of these back to the U.S. So we certainly have our own challenges in our health systems that really also require transformative solutions. So one of the things that we're now doing is trying to facilitate this concept of reverse innovation. So what can we take that's being done well in low and middle income settings and start bringing back to the U.S.? And about a year ago, we created a learning group of organizations in the U.S., in Canada, and the U.K. that are all working together and sharing lessons learned, sharing ideas, developing joint frameworks, and trying to move this field forward. And we're just on the verge of starting 2 new projects that will specifically focus on implementation planning for some of these models of care that are operating in either South Asia or East Africa or locations like that, and bringing them back to the U.S. A second area where we saw tremendous demand as well as innovation is diabetes. Again, diabetes really as a representative of non-communicable diseases more broadly. And so we have brought together a network of 10 different innovator organizations that are working across Latin America and South Asia, coupled that with corporate sector perspectives from technology and other companies, as well as foundations and a government perspective, and even the policy perspective with the Brookings Institution, to actually share lessons learned and see if we can get to a better integrated set of solutions that address diabetes, from behavior modification to diagnosis and prevention to chronic management, as well as management of complications. So trying to take more comprehensive approaches. And again, this for us is a mechanism by which to try to build innovative partnerships, not just innovation in the care delivery aspects and how we're sourcing, but really thinking about novel ways to build partnerships that enable us to have impact. And then finally, we try to make sure that what we're learning is codified and released for more public consumption. And a lot of that is everything from practitioner-oriented white papers to policy-oriented to more quantitative work over time, publishing what it is we're learning. So with that context, what we thought would be helpful is really to, as I said earlier, focus in on one model that seems to be successful and is combining a lot of the aspects that are important for the work that we're all doing together. And that is going to be One Family Health, which is structured as a public-private partnership in Rwanda. I believe we have a short video that will introduce the concept, and then I'm going to ask Lila to walk us through some of the background, and then we'll get into the discussion.